Good afternoon and a warm welcome to today's live session on eye health during times of COVID and beyond, with specially addressing computer vision syndrome and digital eye strain. I'm Dr. Suhasini, ophthalmologist at MGM Healthcare, and with us we have Dr. Ravindra Mohan, senior consultant, Department of Ophthalmology at MGM Healthcare. Hello, sir. So, an average person tends to spend more than about 10 hours a day during the time of COVID lockdown. With everyone working from home and spending more times indoor, there is no escaping screen devices in today's digital age. Frequent and prolonged use of these have been shown to have potentially deleterious effects on the long term. There is a growing inclination amongst kids towards these gadgets as well, adding to their screen time of online classes. All this screen time have us scrambling to fight eye strain, headaches, and sleep problems. While it is a reality that most likely we cannot avoid, we can take steps to prevent them, to protect our eyes. So we shall begin. We also will be running a live question and answer session at the end of the webinar. And so please send your questions in at the Facebook Live, and we can address them at the end of the session. So, what is computer vision syndrome and how can we try and prevent them?
Now, computer vision syndrome, also called as digital eye strain, is a set of eye-related problems and symptoms which occur in people who are using a device like a laptop, a desktop, even a mobile phone or a tablet. And these are ascribable to use of these devices, in the sense that when one is using the device or using this device for a longer time, then one gets the symptoms. And if the person spends time away from these devices, then the symptoms resolve. So that is why the symptoms are very clearly related to the use of the device itself. And as the name suggests, it's called computer vision syndrome or digital eye strain, a set of eye conditions, symptoms, difficulties clearly related to use of these devices.
Right. So who all are at risk for computer vision syndrome? And what is the burden of the disease? Is there a specific population of individuals who are afflicted by it more than the usual?
Yeah. Now, who is at risk of computer vision syndrome? There have been many studies in this area, and what has been seen is that anyone who uses a computer or a digital device for more than 2 hours continuously is at a very much increased risk of computer vision syndrome. And when you look at the burden of the disease, what we call as where how many people, what percentage of the population, I think it has enormously boomed since COVID-19 started, because children have online classes, college students have online classes, examinations, computer professional work has actually increased the number of hours they are working, and everyone for entertainment with the lack of entertainment of going out and other forms of entertainment, everybody is basically using a screen for longer time, maybe double digits, which really affects the computer vision syndrome incidence. And anywhere between 50 to 90% of the population, depends on what population you look at, 50 to 90% of the people have some form of difficulty related to computer use. So that's why there's a huge burden of the problem today, and that's why possibly we are discussing it.
So what are the complaints that one might have, and when does one seek professional help?
The complaints vary from pain, strain, and a vague, ill-defined discomfort around the eyes. It can go on to, in more cases, headache, and some patients would possibly complain of tearing, some kind of a dryness, and also pain in the neck or even in the back, which is ascribable to prolonged use of the computers. So while these may vary from very minor symptoms which go away with just a little rest after the end of one's work, but in some cases, particularly with prolonged use, it may persist through the day and through the week to an extent where working on a screen becomes virtually untenable. So there's a huge spectrum of symptoms. But when must one seek help is the fact that we're going to be over the next few minutes and over the session going to tell on what are the ways to avoid it. This is the first level of prevention. But despite these, if a person is symptomatic, which makes schoolwork, study, or professional work difficult, and ending up with strain and difficulty and symptoms ascribable to computer vision syndrome on a persistent basis, then one must seek the consultation of an eye doctor. And basically, when we are perfectly normal, that part of the body actually does not bother us. So if our backs are fine, we never think of the back. So if you're thinking of your eyes and you're concerned about your eyes when you're working and or even in your leisure time, then possibly the eyes are causing enough discomfort for one to seek attention. I would say that way.
Right, sir. So we have a whole wide array of options available. Something from a regular mobile phone, which now has the entire screen available, to laptops, tablets, iPads, desktops. Would you say there is a safer option amongst these which are available, which is better or which is less harmful to the eyes? Which would you say, sir, or recommend?
Right. Yeah, and that's a very important question which comes to the mind of everyone using a device, if one is superior to the other. I mean, there is a qualified answer to it. The bigger the screen, for example, a desktop and a laptop would have bigger screens than a mobile phone. So in that sense, the comfort of viewing a larger screen is always better, but it must be qualified. For example, not only is the screen size or the letter size important, but also what is important is what angle are you viewing the screen on. For example, most of our tables and chairs are designed by adults for adults. So if a small child is going to be sitting on a table and chair and looking up at the screen, that's a very, very unhealthy way to look at, because normal viewing angle for looking at a screen must be about 15 to 20 degrees below the visual angle. For example, if you look straight, if you look a little down, 15 to 20 degrees, that is a good way to view, where you can view for a prolonged period of time. But if a small child sitting on a high table and chair is looking up at the computer, then possibly the desktop is not a good option. In that sense, a desktop and a laptop with bigger screens offers definite advantage of larger size and a flat surface, etc. But a tablet, for example, a small child can keep the tablet comfortably on her or his lap and view, which makes for better ergonomics and also less eye strain and neck pain and other symptoms. Mobile phones are very easily accessible. So a lot of people are watching movies or lots of hours and hours of work on it. But a mobile phone, at the most, it will have about a size of 6 inches or so, and thereby making it more strainful for the person to see. So it depends a lot on what we are using for how long and what are the body dimensions and age of the person.
Are there any settings that we can optimize? For example, brightness, contrast. How can we avoid glare coming from a computer device or a screen device?
Now, there are many small things that one needs to look at and be careful about. The first thing is the parameters on the computer screen itself. Let's say you're using a desktop or a laptop. Then there's a natural tendency for many people to keep the color, brightness, contrast, etc. at the maximum, which should not be. It should be kept at a very comfortable, somewhere in between range, wherein you're able to feel comfortably and work for longer hours. It should not be kept at the maximum, because the more the contrast, more the glare. The second thing is to make sure that the angle at which you view is also again about 15 to 20 degrees below the line of sight, below the normal horizontal line. In addition, the room itself, for example, there should not be any reflections on the screen. For example, there's a screen in front of me. There should not be open windows behind me. There should not be naked lights or tube lights behind me. because that makes it difficult for the person who's using the computer to see, because it reflects off the screen and causes glare. But also, when you're doing video conferencing, for example, it makes it difficult for other people whom you are video conferencing with to see your face. So it adds to the whole strain in the whole system. So other than this, basically when we say about devices, the human eyes are not designed to look at a glowing object for hours on end. So in that sense, make it glow less and use more friendly, less sharp images the way you can by looking at the screen. And there are of course, there are some screen uh, filters and glasses also, which can cut down the glare. So all in all, one has to keep oneself conscious about all these parameters. Also, one should work with some ambient light. Ambient light means it's best not to work in a dark room with the lighted screen, because in that also the eye strain is more. So one must have soft lighting, even lighting in the room, without lights coming from one's back, so that one avoids reflections from the screen. So these are some of the parameters, some of the things that we need.
I think you have mentioned a very important point about having ambient light around. Most of us tend to work with computers and mobile phones, switching off the ambient light, which is actually more harmful to the eye. Next, we'll go to when does one seek a routine eye examination, or what does a routine eye examination entail, especially in context with computer vision, excessive usage of computers, etc.
Now, any person symptomatic, as we mentioned earlier, with eye strain, with pain, with frequent headaches, must seek a full consultation. And when such a person comes for a consultation, or as part of the full consultation, full checkup, we look at the refractive error. That means if the person does need any glasses, which is not always very simple. For example, in a child, there could be a refractive error. There could be a need of glasses which is masked by the overaction of the muscle. So there can be some which need a little effort to pick up the need for glasses. Also, we look at the eye pressure, we look at the eye movements, the balance of the two muscles, the muscles of the two eyes, any evidence of dryness, and all the other parameters, all the other things which make for eye health, and we set right anything which is not, which is deviating from normal. So in that sense, anybody with eye-related symptoms, with headache, and with difficulty in watching a screen, for example, at the end of the day, there are many people who are not able to see the screen very well, and they have some doubling of the letters and difficulty. I think all those people must certainly go for a complete eye examination, because there are small things which we can pick up, which can rectify, and that makes life so much more comfortable.
Thank you, sir. We also see a lot of redness in these patients who, at the end of the day, complain of redness, watering. Children tend to squint. A mention about how we can identify these issues in children, sir. What we should be concerned about, maybe what parents should look out for.
I think today most schools have some kind of a school screening program. I think that's something that enormously help pick up eye issues in children. Of course, that being one part of the story. But any child who has difficulty viewing the blackboard, one must not take that kind of a complaint casually, but one must get a complete eye examination. Children who tend to keep the books very, very close to the face, or goes and watches the television from extremely, almost standing onto the television screen, keeping books very close, keeping the face in some particular angle. For example, there are some children who may turn their face to one side when they look intently at something, or any abnormal movements or some squinting which is noted either by the parents or the children or by neighbors. All these are danger signs, because these can be signs of some correctable condition, which many times in children, if we don't correct it during the window period, these errors become permanent, or the child may even develop a lazy eye. So for these are in addition to any child who complains that they're having difficulty looking at the screen for a long time, must be taken seriously, and an eye examination must be done.
Can digital eye strain be aggravated by muscle weakness, that is, imbalance of the eye muscles, or general health debility in conditions where, say, nutrition is inadequate or the general health of the person is not good. Does this aggravate it, or how is it related?
Right. So there is an innate uh, correlation between our body health, general health, and the eye health. So it is often noted that when a person has fallen ill, like a fever or ill health for some time, then the eyes become very tired easily, and one is not able to continue with one's work, reading, writing, working on a device, and it takes some time for this to recoup. So in that sense, there is a correlation between general health or debility and uh, eye weakness as well. But even more importantly, as one can understand, we have two eyes which offer us what we call as binocular single vision. That means the two eyes work in tandem, perfectly balanced, to look at any object that we want to look at. So the three-dimensional, the depth perception comes from the perfect correlation, perfect coordination between the eyes. And there can be a disbalance of that. So the two eyes are tending to go away from each other. They're not working together. That can itself lead to a lot of strain. This happens in people who have some tendency for squint, for example, and that must be corrected by either with glasses or with surgery. And I think anybody who's noted to be squinting is certainly should be looked at very carefully. The other thing is very important is that our eyes are designed by nature to look at far. So they are in a resting position. They are perfectly parallel. The axis of the two eyes, they look far away. So we're basically hunter-gatherers, you can say, the way nature has designed us. So we look at the far with no effort in terms of muscle. Our muscles are totally at rest. But when we look at something closer than that, for example, we're looking at reading a book at 35, 40 centimeters, or looking at a computer screen at about 50 to 60 or 70 centimeters, our eyes have to come inwards. The two eyes have to come together so that the axes converge on what we're looking at. So that is called convergence. And many of us have a defect in that. That's called convergence insufficiency, so that the two eyes can't come together and stay together for very long. Now, this condition needs to be addressed by means of very simple exercises and very simple tricks that we can tell, and the patients often get better. So convergence insufficiency is yet another very, very important cause for computer vision syndrome. Digital eye strain can be easily picked up by your doctor and addressed with satisfaction.
Now, the next question would pertain to something that most of us encounter, dry eye disease. What is dry eye disease, and how does this affect our work on computers? And in general, what are the tips that we can do to prevent dry eye disease and difficulties arising from dry eye disease?
Now, dryness of the eye means compared to a normal eye, the tears that one produces are either deficient in quantity or quality. So they can be the right amount, but not the right mix of quality, or they can be deficient in both. Now, this is a condition that occurs in physiologically. That means as we get older, we cross the age of 40, 50, naturally our tear secretion becomes less, which is why older people using computers for a longer time are more susceptible to computer vision syndrome than much younger people. So dryness is physiological, that means it occurs naturally in all of us as we get older. Also, in addition, computer use also leads to dryness. Now, how it leads to dryness is that our normal blink mechanism. The tears are basically the lubricant of the eye, and as we close and open our eyes in the normal blink, the eye surface is lubricated like a windshield wiper. The lids spread the tears all over the eye on the front surface and lubricate the eye. Now, this reduces as we watch a computer screen or a device. So, in the normal course, about 10 to 15 times a minute, our eyes blink. This is obviously a completely reflexive activity. We never think and blink most of the time. And so this reduces, this reflex of blinking reduces when we look at a digital screen for a long time. So you would have seen children watching television or a computer, they hardly blink. So it applies for all of us. So when the blink rate reduces, what happens is the eyes remain open for a longer period of time, and there is evaporation. Also, we work in many times in air-conditioned environments where there is dry draft of wind, which dries up the eyes. So both the reduced blink and the environment in which we work both lead to dry eye. And so it's very common today to find people who are barely in their 20s and they develop dryness of the eyes, which was not the case maybe 20, 30 years ago when device use was much less. So in addition to this, patients who have diabetes or arthritis like rheumatoid arthritis are also at a higher risk of dry eye. So it can occur because of prolonged computer use, and there are many disease conditions. So I think the eye doctor, when you go and see, uh, would do some tests, simple tests to find out if you have actually dryness. And this is a problem which fortunately can be addressed very easily, and patients become virtually free of symptoms after the proper treatment is given.
So basically, we blink more consciously when we are working on computer screens, and we seek medical attention when we feel our eyes are more red, feel dry and gritty, um, to address this dry eye disease. So with COVID all around us, most of us are very apprehensive to walk into hospitals. What would your advice be for those who actually need an eye health checkup, their routine glass checkups? Can they come in? Is it safe to walk into hospitals? Is the question of the hour. What do you think, sir?
Right. I think anybody who needs a routine eye health check, or patients who have glaucoma, the eye pressure is raised, and the person has not had an eye pressure check for a long time, as per the usual protocol, or one's a diabetic and one needs an eye check. I think none of those things now, the present scenario of unlock, uh, needs to wait. I think most hospitals are actually, in fact, very safe places to go, because all of them by now, 6 months post epidemic start, have very, very good protocols in place: social distancing, use of masks, gloves, and all the hygiene measures, using solutions to clean all the surfaces, the material. And most of the hospitals have, in fact, all the hospitals have changed their practice patterns to make them COVID safe. So I would suggest very strongly that routine eye checkups not wait for anything else, because all the practices have incorporated what is state of art uh, suggestions by our scientific societies to be incorporated in our practices.
We can't stress more that hospitals
Yes.
are quite safe as of now, one of the safest places that we can be at.
Right.
Please do not avoid and postpone your eye checkups, which are due, and get yourself tested in case you have any complaints regarding the eyes. Sir, a word of mention on prescription glasses, how they play a part, if they are essential to be used when we are not working on computers, and a lot of people claim that they have special glasses to prevent digital eye strain. A word of mention on that, sir.
Right. I think the use of glasses one has been prescribed are very, very important as part of regular upkeep or regular health of the eyes, for the regular health of the eyes. Now, in children, for example, there could be a refractive error. We mentioned about that earlier, and the child has been prescribed glasses. Now, these glasses are of many types, but suffice it to say that the glasses, particularly the ones which involve some kind of a um, eye strain component. For example, there is something called cylindrical glasses or astigmatic glasses, wherein the eye becomes very strained if the glasses are not used. So in those cases, it's very important to, in a child, any prescribed glasses must be used when attending school, which may be physical school or online school, or using devices. Now, in young adults till the age of 40, the refractive error, whatever is there, is usually a distance correction, and that must be also be used constantly. So the stress is on the word constant, because if it's not used regularly, then the eyes don't get used to it. And there are some kind of refractive errors wherein if they're not used well, then the eye fights the use of that. in the sense that it doesn't tolerate it that well, and then the person's unhappy and the vision's good, not also good. So after that, after the age of 40, we start with difficulty in reading near print and fine print and small things, at which time the suggested type of glasses to be used are what are called as progressive glasses. Now, at one time, I would say many of you would remember that there were glasses which had little moon-shaped cuts in the lower part, which are basically for reading, and that those were called bifocals. But if somebody using a device for longer period of time, or anybody using a device period, not just longer period of time, would benefit by using progressive lenses, wherein there is a smooth transition through the lens for distance and near without a sudden jump, which was there in the bifocal. So anybody using any device must have progressive lenses, which makes it very easy, very smooth, very comfortable, and reduces the strain. So prescription glasses must be worn when one uses a device, and if it's just reading glasses, then one may not need to use it. But I think the doctor is the right person to see you, advise you, and then guide you. And wearing the right glasses would help in preventing computer vision syndrome to a very, very significant extent. Now, your second question, I think, Suhasini, was about special glasses for computers. Now, there are a whole lot. There is some debate about it. Everybody doesn't agree to one point of view on this, but there are blue filters, blue light blocking glasses, which are supposed to reduce strain, and there are a number of them available. Your optician should be able to help you with that. Not everybody agrees that they reduce eye strain or the risk of computer vision syndrome, but there are many patients who swear by it, and there is nothing certainly against using them. Also, the blue light that we mentioned about may or may not have a role in computer vision syndrome itself, but it has a significant role in what we call as day and night, the normal circadian rhythm within the body. So in that sense, if somebody is comfortable, somebody is being prescribed, and if you're comfortable using it, I think one can very safely go ahead using that.
So blue light, like you mentioned, sir, most of our screens now have blue light filters available, and these blue light filtering glasses. So I believe, like you just mentioned, blue light filters help in some way in preventing computer vision syndrome.
Right. I think the jury is out on that about computer vision syndrome itself. But blue light has because the whole point is that you're spending 10 hours, 12 hours in front of the screen. So what is going to happen? People are apprehensive. Vision scientists and eye researchers are apprehensive about it. That's why the origin of these glasses. So there's no today what we practice is evidence-based medicine and evidence-based ophthalmology. So on that count, yes, we still are not sure whether it contributes to computer vision syndrome, but certainly it has a very big role in what is called as normal. The body has a normal rhythm of day and night. So this does upset that. So it's very important, particularly children, young adolescents, if they need to have the regular sleep, then they may not use the device close to bedtime or at bedtime or in the middle of the night, because the blue light turns on the body and makes the night feel like a day in a manner of speaking. So in some cases, it's best to not allow the children access to a device after sunset, and they do the regular homework, pencil, paper, and all that, and then don't use the device till they go to bed. So I think that's the best way to ensure good sleep. But blue light filter glasses and computer attachments are very much, they're very safe and they're good.
So turning off mobile phones, gadgets, screen gadgets, about an hour or so before going to sleep is what is recommended to ensure normal sleep-wake pattern.
Yes.
So there are a lot of home remedies available. People say you do certain forms of exercises, yoga, to reverse glass power. Sometimes, they have tall claims. What are your comments on that, sir? And how are these exercises in turn helpful in case of what we are speaking about, digital eye strain? How can we prevent that?
There are many schools of naturopathy, even within yoga, exercises which involve rolling the eyes up, down, right, left, clockwise, anti-clockwise, and so on and so forth. And also some forms of convergence exercises, which we possibly we told about convergence and weakness of that. What really happens is that these exercises do make one aware of one's eyes, they make one aware of the movements, and also one uses the full range of eye movements that nature has given us. But most of them do not help to any proven extent in removing glasses, because the glasses, it's a different mechanism, which we may not possibly go into at this point of time. But refractive errors, some refractive errors, for example, a cylinder power in a child, which is what we call in the horizontal meridian, can reduce over time naturally without these exercises also. So sometimes a child who's got such a problem goes into a phase of exercises and all that. And after that, naturally, the refractive error reduces or even goes away, then that is ascribed to the exercises. So evidence-based wise, we do not know, but they also do not harm. If the eyes are otherwise healthy, one could always do this exercise.
Very coincidental.
Coincidental, yes. Anecdotal, coincidental.
Yes, sir. Role of nutrition, sir. Do certain foods help benefit the eye health? Also, in particular, some foods which are ascribable to health of the eyes by improving the lubrication or preventing the dryness of the eyes, sir.
Yeah, I think nutrition again is something very important. I'm sure all children were told that they must have the green leafy vegetables and carrots. So these are very good sources of vitamin E. But there's some more popular things which have vitamin E, like mangoes and papayas, fruits, colored fruits which have a lot of carotene and vitamin A. In addition, one important thing is the importance that has been increasingly recognized that omega-3 fatty acids is one of the dietary supplements or components of diet, which is very richly found in some of the fishes and fish oils. Those are very good in the prevention and even management of dry eye. So the health of the tears has become a very important concern in the past decade or two. And these, which basically are from either from fish sources or there are also vegetarian sources like flax seeds, they help in improving tear health. And so, in that sense, prevent dry eye or treat dry eye or correct dry eye. And in that sense, as far as our topic of discussion is concerned, they may have a role to play in the prevention of computer vision syndrome as well.
Specifically coming to reducing strain from digital devices, there is this 20-20-20 rule. So your words on that.
Right. Now, how do we actually prevent a person who's using a screen? And there's virtually very little one can do about either online classes or any work or job or profession which involves using a computer or a digital device. There's no, they advise that you don't use it for so long doesn't just work today in the post-COVID world. I mean, it's a reality. So one must find ways and means of using it in a harmonious way with one's own body and one's own eyes. So in that sense, we mentioned earlier about the fact that our eyes are designed for looking at far. So that's how nature actually made us. That's how we are hardwired. So in that sense, looking at a near object at 50, 60, 70 centimeters is a strain, is a natural strain. It's a natural exercise for the eyes. How you can do any exercise for a longer period is by taking breaks. So when you take a break, what do? So one thing is to take a physical break, shut down the computer or get up, go have a drink of water, look at the garden or the greenery outside, and just walk around and come back. So that's the kind of a break that can be taken in every hour or every 2 hours or maybe a little longer intervals. So that's regular breaks that one takes, which is good for the eyes, in addition to being good for the body and re-energizing oneself. But another kind of a micro break or mini break or micro break one can take is what is called as a 20-20-20. And this is 2020 as well. So 20-20-20 rule basically means that every 20 minutes, for a short period of just 20 seconds, one must look 20 feet away. So 20 feet away means far away. That means if there is a window nearby or a balcony or one door, one just looks at something which is far away. 20 feet roughly converts into about 6 meters. So it's not very far. So one looks away from the screen to something which is 20 feet away every 20 minutes for a short period of 20 seconds. In fact, in the beginning, one can even keep a little memo or an alarm to remind oneself, and then one can incorporate that into one's own regular work. And it's, for example, the example that I often give to my patients is that if you're holding a big pile of books, and then every 20 minutes, for example, for 20 seconds, you are allowed to close those books on a table and just relax your hands a little bit. You will be able to do that for a longer time. So it's something like that. So that's how I think even children can be made to learn this. That they, in addition to the breaks, that small children must be allowed frequent breaks. So that really helps in preventing computer vision syndrome. But also these micro breaks, once they're taught, then they have to do a lifetime of computer use and digital screen use, and it's best to catch them young.
So we re-energize by breaking the strain of near, we look at something distant, and so we can help reduce this. So we are towards the end of our session now, sir. Could you just in brief tell us what is the take home from this session? What do we essentially keep in mind when working long hours on computers, and how to avoid digital extremes?
Now, many of the things possibly that we discussed are very practical and doable. So we've not gone into anything which is based on very high end technology or which needs a lot of investigation or expense, but it's just the use of scientific knowledge. So it's been our effort to try and give a background of why it develops and how we can prevent it. So in very, very simple manner. So I think the things that one must remember is the fact that anyone, whether it be a child or an adult or an elderly, anyone using a computer continuously for more than 2 hours should be aware of this condition of computer vision syndrome and digital eye strain. That means if they are not comfortable with their eyes, they are complaining. For example, the child is complaining repeatedly, or somebody else in the family is complaining that they're not very comfortable on the computer and they feel a little strained, or there's a little pain in the neck or headache, then one must be alert to the possibility that it is computer vision syndrome. So that's the first thing, awareness. Awareness is the first thing. Then is the fact that any such patient should certainly be seen by an ophthalmologist, and a full examination evaluation must be done to pick up what can be corrected. And often the corrections are very simple, they're very affordable, and they're very, very easy to follow, which may be classes, which may be some sets of exercises like for convergence, which possibly I think it's the right time to bring that in, is the fact that one can actually do some exercise for convergence. And the other thing that we need to do is the 20-20-20 rule, which we mentioned about, breaking the screen gaze, that we keep gazing on the screen every 20 minutes for a short period of 20 seconds and look far away. So that also helps in that's something you can incorporate into your daily schedule. And also, if the eyes feel dry, and especially in persons who are older than 40, 45, if they are diabetic, more so, if they're contact lenses wearers, even more so, then some kind of lubricant use, preferably on medical advice after a full checkup, would also relieve symptoms to a very, very great extent. So these are important. Of course, the fact that the posture, it is also important to look at posture when one is using the computer, like we mentioned about children. If a child is not following posture which looks normal, then that also must be corrected after consultation with your doctor or um, with the doctor.
So essentially, be aware of your complaints and symptoms. Seek medical advice when you think you have some issues. Third would be to take frequent breaks when we are working on computers, wherein breaks do not entail switching from one screen device to mobile phones, which is what most people do. Computer professionals, especially, they tend to look at computers in form of laptops and desktops, and then they switch off from that, taking breaks to their mobile phones, which does not really relieve their symptoms. For the use of lubricants, like you said, sir, on advice of their ophthalmologist.
Ophthalmologist. There are some over-the-counter medications also available, which are basically lubricants. We cannot possibly name them in this forum. But in addition, I think the tears are a very, very important part of our system, and increasingly recognized as being so vital for the health of the eyes. So for that, some things are essential, like plenty of hydration. We all tend to drink less water than we should, so one should possibly drink more water, and also good sleep, good quality of sleep, good quantity of sleep, and plenty of fluids, plenty of water consumption helps in preventing dryness. In addition to what we mentioned about blink retraining, that means we need to be aware that our blink rate is less when we work on a device, and we can retrain. It's a little difficult for children, and in fact, the need for that in children is little less because their tear secretions are better than grown-ups and people who are over 40. But the grown-ups can certainly blink retrain, and your doctor should be able to help you and guide you how to do it and advise you further on that as well.
So
Conscious blinking, because blinking is a reflex. But if you wait for that reflex, when you're looking at a device, the brain overrides the reflex because there's something so exciting on the screen that we forget, quote unquote, to blink. But we must then remember to blink because that's very important for us to be able to use the device and to be productive in the long term.
All of this, in addition to a healthy balanced diet and adequate hydration, should ideally
prevent. So these are steps of prevention. But I think any symptom of computer vision syndrome, and these measures have not worked, and these measures have been tried, I think calls for a detailed consultation and to address the issue.
Thank you, sir. So with this, we come to the end of our live session. Please feel free to contact us in case of any further questions and doubts, which you can leave as questions at our live post on the Facebook Live. And in addition to this, the number to contact us for a consultation, both video and in person, are available at these descriptions provided. Thank you and have a nice day.